Hey everyone, it's Dr. Rick, founder of Herbal 411 and integrative medicine specialist. I wanted to discuss the potential problem with muscle tears. That's for everybody. Everybody that's at least a patient of mine, because I am pushing my patients to do more activities than they're used to, or I should say maybe more comfortable with. So in the general longevity space, we always try to get to a certain, on the timeline of living, certain age group. And some people just say, I'll be fine. And then they get to age 60 and they realize, oop, I'm not fine anymore. I've got aches and pains. I can't get an erection. I'm not moist anymore with sex. I can't think, or I can't move as much as before. And then it's not that it's too late, but you got a lot of uphill pushing to do. I always say it's important to start healthy lifestyle early on in the timeline, but things get in the way. Family gets in the way. College education gets in the way. Injury gets in the way, and financials too. So there's always going to be something that gets in the way and postpones your investment into healthy living. I happen to be, I was introduced into exercise I should say, when I was younger, elementary school and high school, it was always martial arts and running. I loved running. And it was mostly sprinting. I didn't like distance. I still hate distance, but I'll do it because I know the value of it. And I started doing that kind of explosive work back then. When I got into college, I started bodybuilding, and that was just an acceptance into like fraternity life and single life, which just accelerated it. So I was able to continue from 20 up until now, 62, going on 63. And I still hold that as a nugget of importance in my life. That doesn't mean I'm trying to push that on everybody else, but most of my patients that come see me, I have a virtual clinic. I run an integrative medicine clinic that involves lifestyle change. So I try to manipulate your nutrition ideas, manipulate your exercise ideas, maximize on sleep, and compress the time frame of healing. I have a lot of patients that have, since 2020, really invested in researching on their own, and there's a girth of information that's really available to you out there. But there's also so much miscommunication and or misinformation that it can be very confusing about which thing to deploy. So I think by default, people will usually do everything, and sometimes that's not efficient either. So my job as a curator or a teacher, that's what doctor actually means in the root word in Latin, is to teach. My job is to teach you shortcuts. And you can get all that online, but sometimes there's just, who do you follow? If you have your favorite podcaster, then continue. But you really should get a physician on your team, because as physicians, we learn about the human body. And the way medicine goes now, it's usually based, or what we practice is, trying to look at what's going to kill you. And the top 3 killers are heart attack, cancer, and neurodegenerative disorders in the world. In the United States, heart attack for sure outweighs everything by leaps and bounds. So we will always look at those things because medicine is very good at Band-Aid therapy and will intervene when it sounds like it's getting to one of those 3 diseases. I work in an immediate care center. We're about to start in about half an hour, but in an immediate care center, which is a step down from the emergency room, we try to put Band-Aids on things before we have to send you to the emergency room. And in a lot of cases in the emergency room, we need that for industrial injuries, motor vehicle accidents, amputations, heart attacks, things like that, injury. And it's important to have emergency rooms, and there's no other place in the world that I would rather be than the United States, maybe Germany, as far as rescuing catastrophe. No, not everything is catastrophe. In fact, I'd say in a rough approximation, 10% of things that are really seen in the hospital are catastrophe. The rest of them are all overuse or long-dwelling issues. Infection, autoimmune disease, gut dysfunction, pain. So I think in the real world, if you can, again, invest in a lifestyle change that's healthy as early as possible, you'll avoid those things that usually get you to the doctor's office. And don't feel bad if you just are becoming awakened as far as how valuable exercise, nutrition, sleep, and community acceptance is, and you're in your 50s, it's never too late, but you really should be exact with what you're deploying and have it work. I think of it like a finance. If you wait until 60 to start saving, and then you do what most 30-year-olds do, you'll never have a bankable amount of money or resources in your 70s to live like you want, I guess. So it's better to invest earlier on. If you have to invest later in life for whatever reason, fine, but be smart about what you're doing. And that brings me back to what I want to talk about today. Muscle injury. I don't have a video on muscle injury, but that's what this one will be. I really want my patients to move forward and progressively overload what they're doing in life. There's a concept of adaptive response that the human body goes through, whether it's a single muscle cell or it's the immune system or the cardiovascular system, for example. You know that when you tick up, say you're going to go run on a treadmill or do an elliptical or ride a bike, your heart rate's going to tick up for a temporary amount of time and then come down. You do that enough days in a week, eventually what happens is your resting heart rate goes lower. So your bottom line, your your basement for heart rate goes even lower, becomes more efficient because you've introduced an adaptive response to say, hey, this guy is making me, the heart, work. I better rest more. So the heart is more efficient, the blood pressure is more efficient when you spike your heart rate or spike your blood pressure. I'm not saying go and have an angry assault on the road, but I think that if you temper it and you introduce exercise in the form of faster heart rate, it will give you a lower resting heart rate. Same thing with muscle. If you want to force the muscle to work harder than usual by either getting more efficient with running, doing that cardiovascular fitness, or my favorite, compound exercises to work different regions of the body, your muscles would become more efficient so that you'll be able to tolerate more stressors in life. If you have to go lift your dog that just got injured, lift your parent that just fell down, lift your baby from a hot tub, you have to deploy things quickly. If you suddenly slip on ice and you have to recover quickly, if you have dinosaur-like reflexes, you're going down, or you're going to drop the baby, or you're going to drop your parent. So, or even reaction-wise, if you are driving at a leisurely pace of 35 miles an hour and a kid jumps out in the middle of nowhere, if your reflexes are slow, you'll be turning like a dinosaur, you'll hit the kid. So it's important to stay youthful, even into your 60s like me, and 70s. I think we can still have the responsive time that will optimize your safety and the safety of others, and your longevity, going back to what I originally discussed. So the only way to do that with every system, neurological system, cardiovascular system, musculoskeletal system, a digestive system, autoimmune system, the only way to really do that is to apply a level of stress or hormesis. If you can put challenges in there, even in the form of learning a language when you're in your 70s, if you can put challenges in your life then that aren't too distracting or too irritating, you will be able to recover after that challenge and adaptively respond to the challenge the next time. So your brain becomes more wired, your thinking is supple, your reaction time when driving is quicker, your reaction time when about to fall is quicker. Your muscular response to exercise gets so quick or so efficient that and the muscles can be the harbinger of health or immune issues. When you have a muscular system that works fast, it can also support other systems. The immune system, for example, the digestive system. So every system, when it's optimized, every system when it's stressed a little bit goes through hormesis and it's optimized to perform better the next time. And what I see happens, so we just had one of the great nurses from here just retired, but he's not going to just retire, he's going to do a lot of things. What I see is sometimes when people hit retirement, they don't have a challenge anymore. And I have a patient that's definitely afraid of retirement, and it's because when he watched his father retire, he just sat in a garage and withered away. I think we have to have a certain sense of purpose. So if you ever listen to Dan Buettner, I think there's a Netflix series, Living Till 100. Dan Buettner was a scientist who studied different parts of the world where there was a higher concentration of centenarians, 100-year-olds. And in 5 different places, there seemed to be a theme. It was family togetherness. Even into the centenarians, they're still with their family. Activity, walking, labor. There was a gaucho. There was a guy in South America who was 100 years old, and he was still herding cattle or herding animals. There's also whole food, mostly plant-based diet, sense of spirituality. So all these things are important, has a sense of purpose to continue forward. So I think it is valuable to stress every system. Now going back to, I keep on going off in these tangents, but going back to muscle. I just tore my hamstring trying to, at 62, going on 63, do a max lift. And why do I do that? I'm sure if I show my colleagues here, why did you tear your muscle? I have a black and blue mark that was just in the hamstring, and now it's filtering all down to my feet. And that's a massive tear. Maybe it's because I'm taking an aspirin daily, but it was a hamstring tear as I was doing a deadlift max. And why would I do a deadlift max? To become more efficient with moving and hiking. I do all this because I want to maintain my muscularity to beat osteoporosis. I also want to maintain joint laxity and suppleness to stay around and hopefully take care of my daughter's and my son's kids. If I can take care of my grandkids and maybe my great-grandkids, that would be a sense of purpose that I wouldn't mind. I'm here to teach patients and you guys. I'm also here to foster health for my family, extended family too. So it always goes down to the fact that you have to stay active, you have to have good sleep, you have to eat properly, and all these things, and have a sense of belonging. And I think it's family values with religion involved. All these things will hopefully move you into that later decade of life, whatever decade you're in, that without a hitch. You know, I always think when I have chest pain or I have a heartburn, oh, is this the big one? And I've done enough tests that I've cleared my cardiovascular system, but I'm still working on it. And I have to be careful with cancer because cancer runs heavy in my family. But I'm doing all these things that I'm talking about and professing with my patients exactly as I would want you to do them. Now, everybody has a little template that has to be, there is an algorithm, I think, but everybody has to have a personal way to apply it. And that's, again, it comes down to having a basic concept of from spring until fall, exercising the heck out of your body. Why? Because I want you to, say, hibernate from fall till spring and not lose any muscle mass and not gain any fat. And if we think of every spring to fall as being, that's when I want you to really push the envelope and cause progressive muscle overload to induce a response that's adaptive and stronger than before. I think we always have to sprinkle in a little activity of some sort, whether it's cardio or resistance or yoga or movement and hiking, to induce you to heal at a better level than before, better than you were before you started, and also exist with a fine-tuned system. All the systems should be fine-tuned, but I think the basic way to do that you will understand, is to move muscle. We can talk about digestion and neurovascular disease and other things. It's integument, muscle. Muscle seems to be the easiest because I think you don't have to have a PhD or an MD to understand, okay, I do this and my muscle gets stronger. Okay, fine. So hopefully this gives you a couple of ideas, but in my case of a muscle tear, I just wanted you guys to understand what muscle tears are. So muscles go from, there's a basic muscle that everybody understands, the bicep. It goes from over here in the elbow to over here in the shoulder, and if I contract this, I will contract and either move the elbow or move the arm, move the shoulder joint. So that's the basic way. Now, if I'm overextended in an eccentric kind of movement and I put force on it, if this muscle attachment, and there's muscle, there's tendon, and then there's tendino-bone junction. But if one of those factors is either weak, injured, or if you're applying too much force to the muscle, or too much for you, you will tear this muscle somewhere. It's postulated that exercise and delayed onset muscle soreness is like micro tears. That's why it's delayed 24 to 48 hours later, you'll have pain. Like in a motor vehicle accident, you might not have pain at the time of the injury, but about 48 hours later, the immune response and the little blood products, neutrophils and basophils will start to go out. Fibroblasts will migrate out to the area of injury and cause inflammation. And there's ways to speed that up: cold immersion, compression, anti-inflammatory herbs, anti-inflammatory prescriptions, muscle relaxers by me. There's ways to tidy that up, but the objective is to induce that micro tear and avoid the macro tear, the torn muscle. And if you can induce the micro tear and just find your little lane that you can hang in, but also recover fast, that would be the perfect objective. And everybody's a little different, especially if you're a newbie. You have to get into it slowly. Newbies always seem to respond to exercise outstandingly. But then after you start exercising for a while, again, the body adapts, and then you're not a newbie anymore. So the same things you did when you first started out won't help when you're advanced with your exercise. And again, that brings me back to the beginning, where I always want you to be progressively overloading. It's usually about every 3 months. And if you're not sure what that means, you really have to ask your physical therapist, your doctor, or you become one of my patients on my Herbal 411 site. So I'll put a link down below to find out more about me. If you don't have a doctor that you trust, seek out somebody in the medical community. I'd always start with that first, because personal trainers, depending on the personal trainer, and you'll see a lot of them that are top-notch online and podcasting, but there's also so wide a variety of the training. In the state of Illinois, you don't have to have certification to become a personal trainer. Anybody can be a personal trainer. And I've seen some good ones. I've also seen some weird ones. So you don't have to go expensive, but you do have to invest. I mean, being healthy, there was a study out of the UK called the CASIDA study, and they studied how much a person would spend with a healthy diet, how much a person would spend with a standard UK diet. And it was a small study, but it was the same amount. Everybody thinks they have to spend a lot to be healthy. You don't have to. In fact, in the United States, there's always been these anecdotal studies. Do you pay for concierge medicine? That's me. I take insurance, but I also charge a retainer fee because insurance reimbursement sucks. And this Herbal 411 integrative medicine thing, lifestyle approach that I have is just a hobby. It's not enough to support me and my family, so I have to work for a big industry. But I think I have a duty to teach people that are just wandering and don't know what they're doing about how to optimize on the information and their health and what they're deploying. I have patients that come back to me after having met me in urgent care setting or primary care setting, and they're in dire straits. And it's okay, I can help, like I mentioned in the beginning, but the later you wait, the tougher it's going to be. And getting back to the CASIDA study, there have been studies that invest or look at the investment you have if you go concierge. And then there's also studies that follow people that don't have the money to invest, so they just go with standard medicine. You know, the amount you pay is the same. So it might seem like it's an upfront investment to see one of us in concierge practice. But if you don't do that and you're trying and you're failing, you're seeing doctors all the time, you're taking disability time because you're injured or you're sick, that will be just as expensive, if not more expensive, than you investing in lifestyle change. So I rest my case that everybody will have to invest a little bit of progressive investment. Let's call it progressive investment, either in exercise, in nutrition, or in hiring a coach to have a great response to stressors later on or medical challenges that might come later on, or medical disease that's always coming in everybody. Everybody's going to age, and with that, there's those three big diseases that will always hit you. As far as when they hit you and how they hit you, sudden versus slow and insidious, hopefully it's when you're in your 70s and 80s, not when you're in your 50s. So those of you who have the diagnosis of hypercholesterolemia, high blood pressure, elevated glucose levels, arthritis in your 50s, that's starting with one leg in the grave. So again, it's okay, but you'll have to work with your doctors, have to have probably several specialists that you see in addition to one of us, the integrative medicine coaches, that will steer you hopefully in the proper direction so you don't need doctors anymore and you can just sail off into the sunset doing what you have to do. So if you do suffer a muscle tear, there's ways to take care of it really quick. I'll probably do another video on exactly what happens in the physiology of a muscle tear, but my suggestion is don't stop exercising completely. Otherwise, consider being my patient. If you're lost and you're wandering, consider being my patient. I'm a very good hiking guide. It's literally, I'm a very good hiking guide, but I'm also a good guide for lifestyle change. Thanks for watching up to this point in time. Put any questions in the comments section down below, and I'll see you online.